Much and hello everyone, wherever you are in the world today. I'm based in the Netherlands, and so it's getting into an afternoon, but it's a beautiful sunny day here. So and I'm really happy to be presenting to all of you. I am, as Andres has said, the managing director of Humanity Link, and what Humanity Link does, I know he described a little bit of it, but what Humanity Link does is really try to create the opportunity for nonprofit organizations to utilize technology to serve the people that they're trying to serve. And how we have done that in the past and how we continue to do that today predominantly is using mobile phone engagement. So what I'm going to speak to you about today is the opportunity that all nonprofits have to engage with the predominance of their population, the population that they want to serve at scale using mobile phones, and give you some success stories and some learnings that we've had on this journey. So my journey started about 24 years ago in the humanitarian sector. So I was in the field, I was with the UN, I was with different NGOs for many years, and I left that space because I realized that one of the largest gaps we had was being able to understand what each individual household needed. We were able to go to a village in a Land Cruiser and interview 10 people and then make a big decision about 100,000 people based on our 10 interviews, right? And that really wasn't dignified. That really wasn't providing that agency that was required to the people that were vulnerable and in need. They have a voice and their voice needed to be heard. So when COVID hit, I decided that I think it was really time for us. It opened up an opportunity for us to be able to utilize these types of tools to speak to people at scale and listen to people at scale, because we weren't able to engage with people face to face anymore. So it really changed the way that the humanitarian sector was engaging with people in need. And we started off firstly sending out with our clients. So we were hired by our clients, by different large scale NGOs, to develop these communication channels for them. So we started off with bulk SMS. So being able to send out SMS, we would have a list of the beneficiaries that the NGO was serving, and we would reach back out to those people, tell them about lockdown, tell them about washing their hands, behavior change messaging, etc. And that's quite easy. You can do it quite simply. You know, there are many tools out there that you can utilize to send bulk SMS. But what's important, I think, to this whole thing is that when we were sending out messages, we had no idea how they were being received. And so we quickly moved into two-way SMS and being able to curate conversations using certain technologies, contact centers. We base all of our work on what's called Twilio, the Twilio platform, but there are other platforms that are out there. And so we created these two-way communication channels where people could SMS us back and forth. What we did find, though, with SMS is that SMS is quite expensive to use. And so we started to now think about, okay, let's find out about the population we serve. Do they have smartphones? Do they have basic phones? Do they call? Do they like to speak to someone? Or do they like to type a message? You know, what was it about them? We needed to curate this. And we call this the design phase. So today I'm going to talk about what we call the D3C approach, which is design, communication, delivery, and dignity. Okay, so we started to design these communications with people in need, and started to understand how they interact in normal times across their families, within the village, with different businesses, etc. And what we found was that in most of the countries that we're working in, and right now Humanity Link has launched programs in almost 33 countries with some of the largest NGOs in the world. And what we find is that about 60% have smartphones, right? 60 to 70% of the population might have a smartphone. About 90% of the populations that we're engaging with in the field have access to a phone. So that could be a basic phone or it could be a smartphone. So then we started to think about, how do we design this? What do we do? And what we came up with was doing two parallel tracks. So we decided, number one, the best way to engage with people are over communication tools like WhatsApp, Signal, Telegram, and Viber, right? It's really cheap. We can do a lot of fun things with it. We can get a lot of data. We can get location. We can do many, many things in an encrypted way, especially over WhatsApp, in an encrypted way to funnel services to the people that are in need and listen to those people, okay? Then the next thing was we started to build a parallel system in what's called USSD. So USSD is a bit of an archaic technology in everyone's phone. Anybody can play with it. You know, if you type in *100# or *1567#, you can find out about your phone and everything. And it's a SIM-based technology. So it actually gets into the SIM card. And what USSD does is opens up a conversation between you and the other user for a period of time, usually about 120 seconds, where you can facilitate a conversation, right? It's a computerized conversation, but you can ask many questions at once without sending SMSs back and forth. And so we build out WhatsApp chatbots and Viber chatbots, and then we build out the USSD channel and ran them in parallel, knowing that then we had people that had smartphones and people that had basic phones. As we went on throughout COVID, this started to expand because WhatsApp and the use of these types of channels was really effective in the populations we were serving. So effective that it actually shifted the way that the partners that we work with had to structure their human resources, because now they didn't need as many field staff. They actually needed data analysis staff because we were exchanging so much information with people and gleaning so much information. One great example of this is what the Norwegian Refugee Council did in Ukraine. We built a self-registration app so people can self-register. They go into WhatsApp, they can register. It's encrypted over the WhatsApp for Business application and ask them questions. And in the back end, we can score them. We know what their vulnerabilities are. We even have unique identifiers. We can do facial recognition, and it doesn't mean that we can validate their ID with their face. We can provide KYC information for banks so that we can distribute cash over the system. So we ask all the information that we need to get so that we can distribute cash to them right away. And in Ukraine, in the last year, that system has exchanged over 200 million messages, and has registered over 1 million households. And that registration of those 1 million households was over a 40-day period. So if you can do the math on that, right, that's we registered 1 million households, 5 million people in 40 days. Now that would usually take a traditional NGO, even a UN agency or anyone else out there registering a population. That would take months, potentially years. And we were able to do it in 40 days with the tool. So I want you to understand the scale and the scope of what we're talking about when we talk about engaging with people. What that shows me is that people want to have a voice. They want to speak. They want to tell their story. They want to tell what they're facing. But it also comes to us around the AAP, or accountability to affected population. It comes to us because we have to then, once we hear their story, we need to do something about that story to address that vulnerability. So what digital communications and digital community engagement does is flip the paradigm completely, transforms completely the way that NGOs engage with the people that they're trying to serve. Because now, if that person tells me that I have 3 children, I don't have any food, and I've got one child that's celiac and another child that's lactose intolerant, right? And I need to get special medication for them. I now have that data, and I can design my cash basket for them based on that data and send them the right amount of cash that they need, or send them the correct voucher that they need. And then what I can glean from this is what I might find is that there are certain threads across the population that we didn't know about, right? So I can find out that, oh, actually what we've got is 80% are female-headed households in this group. We didn't even know that. Now we have to rethink about the way that we're engaging with them to make sure that we're servicing the mothers that are there, the females that are heading the households, differently than what we would if it was, for example, a male-headed household, and those types of things. So it really is very rich in its data collection opportunity. It's very rich in its ability to create an opportunity for us to serve people in a better way. And it also is very important because now that I've told my story as a beneficiary, now that I've said what I need, I can hold the NGOs accountable who are asking me what I need. In general, when we go out and do focus group discussions and everything, they're all good, they're all important, but that's traditional community engagement, and there's no accountability to a focus group discussion, right? There's no name, there's no face associated with that. When we use digital tools to engage with people, we now have a name, a face, a location, a need, an address, a bank account. We have everything that we need to service them as quickly and as succinctly as possible. And so when we design those things, we communicate to people, we tell them, ask them the questions, have them communicate to us. We then provide the services over the mobile phone so that they're able to access assistance, but over the phone. We're not sending them to different places. What we're doing is giving them the cash they need, or referring them to an organization that might be able to assist them better, or referring them to a government entity that can provide a social assistance package to them. And what I believe is, and what we found throughout these different countries, these 33 countries that we've been working in, and soon to be 40 by the end of 2023, is that really starts to bring dignity to them. Instead of us giving a handout to someone, we're actually shaking their hand. We're creating a partnership with the people that we're serving. And it's a really great opportunity, I think, for humanitarian organizations globally and development organizations to be able to use these types of tools. I want to give just some examples of how these tools have been used in the past. There's a very long list of use cases, but I just want to run through a couple of them just so you can to spur some thought. So in Mali, we built a early warning tool using USSD, where anybody can type in to the text and tell us what situation they're facing, where they are, if they need assistance, if there's displacement, if there's access. That pushes directly to a map. And then in the NGO's office, they can view that map at any time to see where different things are happening. So because they had a rapid response team in that NGO to be able to go out and help people. We're able to do lots of other things like complaints and feedback. You know, one of the things about accountability to affected populations, one of the things about community engagement is that complaints and feedback mechanism. Well, it's very simple, especially right now in Venezuela. The Norwegian Refugee Council has launched a very large complaints and feedback mechanism in Venezuela. And Colombia is launching the same. For NRC, we'll be launching the same. And then very soon with the Red Cross, we'll be launching a blood donor WhatsApp chatbot for the Red Cross, so that all of the 800,000 blood donors in Colombia can engage with the Red Cross and be able to share, I can go, where do I go? And we can give them information about scheduling. We can provide scheduling. We can provide the nearest blood bank where they can go and et cetera, and get those things. We can also push out information to them to tell them what kind of blood we might need. For example, you could say we need O positive, we need O negative, we need AB, and we can push that out to the group of 800,000 blood donors so that they then can go and donate blood. What's also very important from a technology standpoint, so let me talk a little bit about the technology as well, because in the back is what we call APIs, and many of you, I'm sure, have heard of what APIs are. But these are APIs with different service delivery, right? So from these APIs, we can do a number of different things. We can distribute cash, so we can do this in cash assistance. We can refer them to another organization. We can create an identity for them, so we can do digital identity right now over that. We can send them vouchers if we want over the system. We can, for example, send a team. Once they send us their location, we can immediately send a team out. We can call an ambulance on their behalf over the system. So what we do is we build with you the conversation, and then we build out the service delivery mechanism so that, and our main goal is, when working with NGOs, is that you can reach 70% of the population that you need to reach over the mobile phone. The other 30%, you have vulnerable people, people that might not have phones, people that can't leave their home, people that aren't very digitally aware. And so that's where the NGOs really have their bread and butter, right? But 70%, if you think about a population of 1 million people, you can reach 700,000 just through designing your communication channels in the right way so that you can engage with them. And then your funding, the bulk of your funding, then can be spent on getting out into the field and helping that other 300,000 people. Some other different use cases is over the phone. We also build call centers, right? So the opportunity is that people can call in if they want to call in. We also help to manage. In Libya, we built a call center for migrants where they could call in. And if they wanted to talk about resettlement, the phone call was directly routed to UNHCR. And then UNHCR had a call center operator there that would open up their ticket. When they call in, they give a little bit of information. They open that up and then they call them back. The same thing, if they said they needed legal information, then that phone would be transferred over to NRC and NRC would provide the legal information. So it goes on and on like this. So we can do what we have built and we are building, and I think you all can build and can use phone systems, chatbots, SMS, USSD, and you can also bring them all together so that you have a very succinct omnichannel presence to engage with people in a very meaningful way. So I'm going to stop there and say thank you and just tell you that this type of work can scale. It does scale, but you need to be ready for scale, because when you launch some of these, if you don't have the staff and the data analysis and the people that are behind you, the data will be meaningless. It's just going to be a CRM or an Excel sheet that's now populated with nobody to read it. So make sure that when you do this, be prepared for scale, because everybody wants to have their voice heard, and now you're giving them a conduit to do that. And so it's really important that you prepare yourselves and that you explain this. Last final piece, because Angelina was here. I always kind of say this at the end. A big part of this is around the donors. When donors hear about us using technology many times, they look at it in a few different ways. One way is they look at it as an IT cost, right? Digital tools are not an IT cost. They are a programmatic cost, because that's how we can deliver our programming. So being able to talk to the donor and make sure that you're able to put your digital tools in your programming costs and not your IT costs, because they should be different, right? IT is your computer, right? Digital tools to engage with people is programs, right? The next way that they look at it is in terms of a project. Now, something about digital tools, when you open up the floodgates, it's very hard to close them, right? And so when you open up a digital tool, you need to have the longevity and sustainability within that tool for it to continue. It shouldn't be a short-term decision. And so with your donors, please work with them to understand that if you're launching a digital communication platform, that it's something that will need to go on until that displacement is over. If you stop it halfway, you've taken everybody's voice away. So there's a lot of responsibility when opening up and using digital tools. But I think if you explain it to the donors well enough and you explain it to your management, that creating the sustainability plan at the beginning so that it's not project-based, but actually engagement-based, that you'll be able to be really successful and help a lot more people. So thank you all very much. And I hope you have, I think we're going to maybe have a few questions, Andres, if we can. And if not, then I want to say thank you and I wish you a lovely day.